I'm going to talk today about inflammatory processes in pancreatic cancer. Inflammation plays a major role in the initiation, the early development and progression of cancers. There's a clear association between chronic inflammation and cancers. And this is a table which shows you certain infectious agents which can cause chronic inflammatory diseases, which increase the risk of developing cancers in that organ. Besides these infectious agents, there are other factors, including environmental and dietary factors, which can cause chronic inflammation and tumors. Chronic pancreatitis, either caused by heavy drinking or some genetic mutations, can cause or can increase the risk of developing pancreatic carcinoma. 10 years after the diagnosis of pancreatitis, there was a risk of about 1.8% to develop pancreatic cancer in this cohort. This risk increased at 20 years. The risk was about 4 years. So 4% of these subjects developed pancreatic cancer 20 years after the diagnosis of chronic pancreatitis. So there was a 14.4 higher risk of developing pancreatic cancer than what would have been expected in the general population. Now, the association between chronic pancreatitis and pancreatic cancer is even more clearer when you look at cohorts which develop chronic pancreatitis as children. And the mean age at the onset of symptoms of chronic pancreatitis in this cohort was about 14 years. And 8 of these 246 patients eventually developed pancreatic cancer with a mean duration of about 40 years, which also tells you that it takes probably a very long time, if you have chronic pancreatitis, to develop pancreatic cancer. And there was a 40% risk of having pancreatic cancer at the age of 70 in this cohort. What is interesting, if these patients inherited the genetic mutation from the fathers, there was a 70% risk of developing pancreatic cancer. This is a cartoon which shows you the structures and the components of a malignant invasive tumor compared to an inflammatory disease, in this case a normal wound healing. So basically we have the same cellular and structural components in an inflammatory site and a tumor. The difference is that this inflammatory reaction is self-limited. Once the defect is closed, the inflammation goes away, while the tumor is basically not limited. This led to the term that tumors are, in fact, virtually wounds that do not heal.